Here's the image again of your spine after the injury, where we see a large projection of the fracture essentially compressing and cutting the spinal cord. We even have a gap that appears here on the image. And then here it is after the treatment with, sounds like, multiple treatments and also physical therapy, but also with the placentally derived protein array or PDPA technology, where we now have this kind of connected here. What do you see like functionality wise, I guess I should say?
When I first had my injury, I couldn't move anything. Mom literally had to scratch my face whenever I first had my injury in the hospital. I would have people have to shave my face and brush my teeth. I couldn't do anything. Finding out about y'all and these treatments, when I first started doing these treatments, I think the first thing I noticed was a slight change in body temperature. Like when you have an injury like this, you tend to either be like super, super hot or super, super cold. Like you just have these crazy temperature fluctuations. And I remember when I first did my first stem cell treatment, I noticed my hot and cold sensations weren't as bad as they were before. These new treatments actually with y'all, I'm 4 treatments out of 12. I mean, so far, I've gained so much more sensation. I'm able to move my arms. I'm able to sit up on my own. I've gained feeling on my back, on my bottom, on my arms, my fingers, my legs. Recently, my toes now and the bottom of my feet.
Welcome to the Medical Entrepreneur Podcast. We are here with 2 amazing guests. We have Nando Batista and his mother, Kristina Hodges, that have joined us. We have a very special episode today. It's a truly amazing story, and we want to share with all of our audience members. Fernando, if you don't mind, maybe to start out and tell us a little bit about everything that you've undergone and the story, like what's happening in your life, et cetera.
Yeah, thank you for having us, Dr. Sewell. I wanted to start off with saying that I'm just so lucky that I get to share my word. And I'm 23 years old. I've grown up in Texas my whole life. I played sports my whole life. I played football all the way up to college. I played my freshman year of college too. And I went to Texas Tech. I transferred to Texas Tech my sophomore year after playing football at a small university called Southwestern Assemblies of God University. After playing there, I had some buddies who were already at Tech. And Mom actually went to Texas Tech too. And she was just like, hey, you should go check it out and go see what you think of it. And I visited and I fell in love with it and ended up going to school there for a while and joined a fraternity, made a bunch of new friends, and flash forward to senior year, there was a fraternity party that we have every year. It's a Hawaiian theme party. And there was an above ground pool. And as I was climbing on the top step of the pool, I slipped and fell head first and ended up breaking my neck, which I know to a lot of people it sounds terrible, which it is, but I've learned so much along the way. And I just, like I said, I'm just so lucky to have so much support. I'm just lucky to live in a country where we're able to do medical procedures and treatments. And it's just great. It's slow, but it's good.
And so could you tell us a little bit more? So you fell into the pool, you hit your head, and then what do you remember after that?
So I remember hitting the water and I didn't understand what was going on. I felt right when it happened, it was a paralysis now that I know, but at the time it just felt like ice kind of freezing over my body and it was really hard to move. And I was face down in the water for, I don't know, maybe 2 to 3 minutes. And a lot of my buddies thought I was joking, playing around. And it turns out I wasn't. And thank God, I had 2 people pull me out of the pool. And I do remember like laying down, face down in the water. And it's funny, I wasn't scared. I felt more, I don't know, I just felt like realizing, wow, this is so real. Like I'm probably going to die in this spot. And people don't realize it. And thank God I had my 2 buddies pull me out of the pool. And, but the crazy part, I was awake for it all. So I get pulled out of the pool and I go and they take me outside of this venue is like this courtyard style venue. So there's a bar on one side, there's a bar on the back side. There's a stage where we had the musician play, and then this outside courtyard where everybody was at. And then there was a pool in the back with some like a deck to overlook the party. And yeah, so that when I got pulled out of the pool by the two guys, yeah, they just were like, "Don't move," and the ambulance showed up, and they put a neck brace on me and took me to the hospital. I went to Lubbock UMC. God, that night felt like forever. I remember all these IVs getting put into me and having to do a bunch of CT scans and MRIs, and it just felt like forever. It felt very fast and very slow at the same time, which is a weird thing to say, but I think my body was just in so much shock of trying to realize what was going on. I don't know. I couldn't think. It was just going. And I remember it was so funny. I remember feeling so nervous. Like the biggest thing I was so worried about was like I was laying there in the hospital bed and I wasn't thinking about my neck or what was happening. I was like thinking, oh my God, my mom figures out about this. She is going to be so pissed at me. And I remember like talking to one of the nurses there and just begging her, please, please give me my phone so I can call my mom and let her know I'm okay. Because prior to this, like when I first had the injury, my buddies, some of my best friends were calling my mom and telling her what was going on, but they didn't really understand either what was fully going on. So there was this like state of panic. I wanted to make sure my mom knew that I was going to be okay. And so I got to the hospital and I called her and I was like, "Hey mom, I'm so sorry. I had an accident. Something happened." And she was just so frantic. I could hear it in her voice. And keep in mind, we live in the Dallas area. So the drive from Dallas to Lubbock isn't really a quick 30-minute drive. It's about 4.5, 5 hours. So they literally, from what I was told, they packed up everything and left. And yeah, it was, it was just a very hectic, long night and probably one of the most intense things I've faced so far in this life.
And then after the accident, when you were in the hospital, was there a time where you started to notice that you couldn't move your extremities, or how were you feeling at the time?
Yeah, there was, I think when it really hit me was when I got pulled out of the pool and my buddies were like carrying me and I was like laying in the front and everyone was telling me not to move. I remember everything being like just really heavy and like really like I didn't understand why I couldn't just sit up. Like it felt, because I was awake for everything. I think I was probably floating in and out of consciousness here and there, but I remember like everything. I remember everything from hitting my head in the pool. And I remember my eyes were open underwater and I remember seeing bubbles like kind of stream up and around my cheek and up to the surface of the water. And I remember getting pulled out and everything just felt really weak and limp. And yeah, that's the main thing. That's when I realized and I was like, oh my gosh, it's serious. I don't know what's going on. Maybe thought it was like a stinger from like football or something that I've had before. And yeah, I think it really hit me like when I got to the hospital and I had doctors tell me what was like actually going on. That's when I don't know, the reality kicked in.
And then, Kristina, if you don't mind to tell us your perspective of what happened to that point.
Okay. Even now, years, it's been over 2 years, it's still just so heartbreaking to listen to him And of course, I remember got a call at it was 10, like about 10:15 or 10:20. And his best friend, who was also in his fraternity that he grew up with here in Dallas, called me, and he was just, this is Hodges, this is Hodges. Nando had a really bad accident and he's not moving. And I just dropped the phone. My husband, thank God, he's really calm in situations like this. He picked up the phone and he said, we'll be right there. We'll get there as fast as we can. And we left in about like 16 minutes from the time we got the call. And we had my youngest son, we have a 11-year-old who was 9 at the time. He had a friend for the night and we just worked everything on. Anyhow, I have to say that the drive over there was probably the most excruciating thing that I've ever dealt with, not knowing what was going on. And since he was over 18, they wouldn't give me a lot of information. And so on my side, I'm calling the hospital and begging them to tell me what's going on. And they're saying, just get here safely, drive carefully. And I was absolutely convinced that he had died. And God is just so amazing. And how during that time, that's when he was telling this nurse, I have to call my mom. I have to call my mom. And literally within, I was just like, oh my gosh, he died. And they're not telling me. And it's like, flash, all these, it was just the worst feeling ever. And then the phone rings and it's him. And I hear, and I'm like, oh, somebody found his phone. And I answered, he's like, Mom. And it was like, my heart was just like, oh my gosh, he's not, thank God, hey. And he told me the same thing. Mom, I'm sorry. I'm like, why were you sorry? I don't know if I must have been very strict on him that he was afraid to tell me that.
She was.
I was.
That was the first child. So I got the butt end of the stick in all the situations.
And the nurse, after I spoke with him for a few minutes, the nurse there, she called me from the trauma intensive care surgical. So it's like the worst of the worst. People with verbal car accidents, that's where they fly them in from all over the county. And she said that she had worked at the hospital for 19 years and never, not once, has she ever called anybody, allowed anybody to call. And she said, your son was unrelentless. He was unrelentless. And I've never, and don't I know that? Believe me, when he wants something, he will very, and that's why we're in right now this position where he's getting better. He is getting better. And going to the hospital, not knowing still what was going on. And that was like the end of COVID, which was awful. So like only one person could be there. And it was just a horrendous situation. And when the doctor came in and just confirmed what was going on, it was like, I don't think it really even hit me. It was like, okay, so this happened and he's going to be that percent that is going to recover from this. And I can tell you, there was not been one time where we have been told by doctors, she will never walk. They literally told me he will. So his injury was 5 and 6. And then from what was explained to us, and they had to put the hardware in 4 and 6 to stabilize the 5th vertebrae. So they told me he's from the neck down, he's not going to be able to do anything, and just basically accept that this is his life. And they had to see a psychologist and just pretty much accept it. This is it. This is how you're going to be. Never once ever did I say, okay, let's accept this. I was like, this is not you. You're going to walk, son. You are going to walk. You are going to walk. You are going to walk. This is not you. This is part of your journey. This is not you. And yeah, so now, by the grace of God, He's accomplished so much. And we are, thank God, in the great position where, you know, we're so much luckier than 99.9% of the people that have this injury, where we have friends that know friends that led us to you and to David and David Bell. And we're just really lucky. So we were able to really think out of the box with a lot of things. And I think for the most part, people believe anybody who is a doctor, and particularly Western medicine, it's like very factual and they look at this part and they don't look at what happened in this part and how this can affect that. And this is incredible.
Absolutely. To jump back to the story, basically, this is now day 2, I guess. You wake up in the hospital, you're not with him, and basically the doctor has said, "Hey, do they rush you to surgery for right away?" Like, what happened with it?
It was day 1 when he was.
So when I broke my neck, I called mom literally that night. It was late already. I don't remember the time. Everything just felt like I just lost track of time. And I was up like all night the first night. There was no sleeping at all. I was just filled with a bunch of drugs just to ease the pain and stuff. And so the following morning, the surgeon, the doctors, and I guess the surgeon who was going to do my procedure came in, and they were like, "We are going to do your surgery right now." And this is like 7 a.m. I'm just so tired. Keep in mind, I'm probably slightly hungover from a night of drinking. And the surgeon just comes in, "We're going to do your procedure." And then that was another thing that hit me too, because he came in, he was like, "We're going to do it. And there could be a potential of losing a lot of blood. This is a very hard surgery. It's potentially a risky one." They were just letting me know, and I was like, "Oh my gosh." They did say they had blood on standby just in case, but I was like, "Oh, I hope that doesn't happen." So they cut the front of my neck right here, and then they cut the back of my neck open. They did I don't know which procedure they did first, but I know that they did one procedure. It's either the front of the neck or the back of my neck, and then flipped me over, or I guess flipped me back on my back, and did the other procedure. And I honestly don't know how long the procedure was, but I remember waking up out of the procedure, and it was like one of the worst pains I've ever that I've ever felt. And that was even on drugs. It was just excruciatingly painful. My neck was sore. I couldn't move anything at that point. I couldn't move anything. Keep in mind, I forgot to mention, before I had surgery, I think I was able to wiggle a couple toes. So I had a little more function than I did after the procedure. So I woke up out of the procedure. I couldn't move anything. Like, I was just like, I had an aspen collar, and what an aspen collar is just your basic neck brace that has a Velcro. That Velcro is on each side, and it connects in 2 pieces for the people who are wondering out there. And I had my aspen collar on, my neck brace, and I remember just laying there in so much pain. I couldn't even move my head left and right. Just a simple movement like that was incredibly painful. And I just remember like really swollen face, but I came out of procedure. The procedure, thank God, went really well. When you have your neck cut open, it's not going to feel good at all. Yeah, the procedure went well. All my family was with me. They finally came in town. They were with me. And yeah, I remember another thing too. I was so thirsty. And when you have an injury like this, you initially breathing and swallowing it can be affected. I never had to get a trach, thank God, but it was really hard to swallow and it was really hard to breathe. And I remember feeling so thirsty. Like I probably hadn't, when I had my first sip of water, it was probably maybe 3 days later, which it sounds crazy, but they put you on a bunch of IV fluids and to keep you want to keep you alive. But I just remember my mouth feeling so dry and it was real hard to breathe. And I remember being in the hospital and I remember just laying there and it was just so painful. And I remember for some weird reason falling asleep and because I was so tired, I remember every time I'd fall asleep, for some reason, I would just stop breathing. And just the feeling of just being so fatigued and so tired that my body just physically was struggling just to breathe. And I remember at one point, man, my oxygen probably dropped down to like high 60s, 70%. And then I'd wake up and start breathing again, but I would realize I'd fall asleep and the machines would just be beeping. Like when you go to a fast food restaurant or something, it sounded like the McDonald's fries machine or something. And I just remember waking up and it'd be beeping and I'd look at my oxygen because I'd have the screen where I can see it. And my levels would be so low and it was so scary. It was like that for the first maybe week and a half, 2 weeks in the hospital. I'm just glad I got that out of the way. And there was also a lot of benefits to it too. Like at Lubbock UMC, a lot of the women from tech get out of nursing school and a lot of them end up working there. So I was surrounded by a bunch of cute nurses and it made it a little bit easier to pretend to be tough, even though deep down I was like a little crybaby. I just remember everyone was super friendly there and it just felt just really long. And I remember also the medications that I was taking, like pain medications, I would get really crazy hallucinations, just really crazy hallucinations where I would see things floating in the corner of the room or I don't know, like I remember I had one where I felt like I was like in a casket or something buried underground and everyone was standing around me and they were probably maybe 6 or 7 feet above me. And I remember being in this hole laying like this and everyone's just looking down at me and I couldn't understand what they were saying, but they were all talking to each other. And I just had really weird, vivid hallucinations. There'd be times I'd be laying in my hospital bed and I'd wake up out of sleep and I'd be like screaming for my parents' names. And they're like, what's wrong? We're right here. And yeah, I don't know. It was a real like long, it just felt long. And I don't know. I think it also comes with, I don't know if I'm saying it correctly, but there was a thing called like ICU delirium sometimes where people experience some sort of like literally delirium from being in a place where everyone's awake like 24/7.
And likely, as you probably remember from the ICU, people are coming to bother you all the time, collect blood, etc.
Oh,
And you never get any rest because there's always something going on, right?
those blood work ladies, ruthless. They'd come in at 3 in the morning. It's just flip on the lights, the bright hospital lights, not the soft ones that are like lounge lights. They're like the bright hospital lights and just wake you up and just take blood and then they'd go on their way. But yeah, I remember nurses coming in too every 3 hours or whatever, every 2 hours, like coming in and checking on you and which was needed. You're literally on the brink of death. Your body's trying to just fight to stay alive. I hope someone's monitoring me. But I remember just feeling like I was going crazy just being in there for so long. And I'm glad to put that behind me.
And Kristina, during this time, what was your experience? Obviously, you mentioned before you kept this faith of like, hey, we're going to get through this no matter what. And no matter what anybody is saying, at this point, the doctors are saying, hey, you're not going to be able to move anything beneath your neck. And you're just like, no, he's going to be okay. He's going to recover.
I definitely, it was it was heartbreaking to see this guy who was just so built and muscular. And when I first walked into the room, he actually had a halo on, not like a bring, like some kind of neck.
It was my neck collar. That's what it was.
But this is before the surgery, and he was so tan and his teeth were so white, and I don't think he realized and he was on pain medication, what actually was really going on. And it was just, oh my gosh, like this kid is not, this cannot be the kid that they're talking about. That is not ever gonna, they actually told me he's gonna be like mush from the neck down. And literally, like Nando said, it was definitely, we got there at 4:00 in the morning, was at 7, probably slept 30 minutes. That, gosh, for 2 nights, I don't think any, it was really scary because after the surgery, he was having a hard time breathing just from the nature of his injury. Plus, he had a lot of phlegm from the tubes from the surgery. And I
mean, was so congested, and I couldn't cough. When you have this injury too, you can't cough at all. It's you can't cough. It's terrible.
Like that, I had no problem with taking. If I could have done everything, I would have definitely done everything. But if we were sticking tubes, we're not going to wait for the nurses to get in there and put that thing down his throat. So we figure out how to do it.
Sorry, I remember that too, having to put like tubes down my throat a little bit because I couldn't cough, and I was so congested in my chest that I would. It was the worst feeling. It felt like swallowing a pill or something, or like a straw, and you just put it down your throat, and it sucks up all that phlegm, and you take it out. And I just remember constantly doing that, and it was terrible.
It was terrible. Definitely the surgery. He had it at 7:00 in the morning the next day, and initially they were going to wait and see what they should do, if they should do the surgery or not. And by the time I got there, which was a little bit like 4:45 in the morning, 5:00. We was a little bit earlier than that, but when the doctor came in and said, we've decided that this is going to be the best thing if we do the surgery. The quicker we do it, the better chances are that it'll go better for him. And he, on his left arm, he was able to move it. And the doctor was very surprised how strong he was from that, considering his injury. And I know after his surgery, he moved his toe a little bit. I don't remember him doing it before surgery, but to see somebody just so active and everything to the point where he's, Mom, please scratch my cheek. Mom, please, I have an itch. To where he couldn't even he couldn't relieve himself in any way. He was just so vulnerable to every single person, just to everything. That was really, really overwhelming for me, just to see him so opposite of how I've known him. This is a kid that hated, if he was at home, he hated to be inside more than anything. So I think that's probably the most hard thing for him. Throwing the football all the time we're so physically active and just a strong kid, and tough as nails when it came to being sick, and he would hurt himself, and he could handle a lot of pain. So to see him in pain was like, oh my gosh, this is really hard for him. And like you mentioned about having those hallucinating, he would have the worst nightmares where he would wake up like screaming. And he was just so terrified. And he was so terrified to fall asleep because he would stop breathing. And they were very close to putting a trach in him. They said, if it continues to be like this low, we're going to have to trach him. And just another blessing that we had where he just was tough. He was just so tough. There was actually a point, like maybe 2 days later, I hadn't showered. I didn't know really what was going on. I didn't have very I don't even think I took clothes. I was walking in the hospital and I had my blanket and I got lost. This hospital is like so easy. I was just totally confused. I thought, we're this close to just being a crazy person. And I seriously was like, this is how people lose their minds. It is the no sleep and stress. And as a parent, I'm sure if any parents are watching this, you would cut off your arms and your legs and literally to have this happen to you instead of your child. There's nothing in the world could happen to you that would be as bad as something like this happening to your sons. Yeah. So it was, and somehow we managed to laugh a lot.
I got dark humor through it, so it helped me push through.
And our family is just such an amazing mom. And I have such my husband and his dad. Just the thought that we were even every blessing that we had, like just being able to hop in our car and driving to Lubbock. If this happened to my brothers or I when we were kids, my mom's car wouldn't even have made it over there. To be able to go to Lubbock and stay in a hotel when people are having to sleep in their cars, it's just such a blessing. And it's just like recognizing all those things, all this is going on. Thank God that we were able to do that just because like this is really bad, but this is really, there's a lot of good things too. While he was in the ICU unit, two moms lost their sons about 2 days, and like one day and the next day. And I have never ever heard more. The cry of a mother who has lost their child is something that you will. And I'm just, gosh, I thought, oh my gosh, I don't know like how this happened because he could have easily died. He told me, I don't know if you remember this you telling me this, son, but you told me, you're like, I was counting the bubbles coming out of my mouth. He was like, I was gonna.
I do remember that. I really remember being in the pool and thinking, like, I'm going to die. Like, I really slowly came to terms with myself, knowing it's a part of life and people die. And I remember being in the pool and just like realizing that. And it was very eye-opening. So,
Wow. And then what was the next part of the journey? Because basically now you've had the surgery, you're 2 weeks in the hospital. When did you get discharged? Kind of what happened next?
So when it happened, like I said, it was at the later part of COVID, but they were still very strict about letting people in, and he couldn't have anybody. I wanted to really I was so grateful for the hospital, that the nurses there, and how they worked it so that he could be, he's a guy's guy and he loves his bike. He has so many friends, and he wasn't able to see anybody, and his brothers out there were devastated. This affected and still affects so many people. He had friends that he's known since the second grade that they were always together. And so it was devastating.
I lived with them in college too.
Yeah,
they were literally my roommates. So
Wow.
These guys I've known since like elementary school.
Yeah. The nurses there were like, okay, we're going to tell his friends that they will take him to the front of the hospital so that he can see them. And I told a couple of his best friends, and we walked out, and to see the sea of people that were there, they were so taken back. And it's
We have photos too to show it too. So
Yeah,
if we ever figure out a way to pull it up on here, we can show everybody.
but it was just so touching. And another thing that was really amazing, and I'm probably adding way too many details about, but he's always struggled in school, like always. And I had withdrawn from the university. And when I called, they told me, I was like crossing my fingers and, okay, tell me what is his standing? And they said, he has been on the teens list for several semesters. And I was like, here's the name, right? It's my son, Fernando. But I was just so proud of him. But nothing could have made me more proud than how determined he's been to get out of this. And there's a lot of times where it's super hard and it's very devastating to him still, because it's not like knowing like you broke your arm, we have this time that it'll heal. It's just really unknown. And we were at the hospital for 3 weeks over there, and then we had to, in ambulance, move him back to Dallas, where they have a spine. They have a spine
rehabilitation center.
Yeah. And logical, real, yeah. So we moved him there, and he was there for 2 months.
I remember the ride there too, from the hospital to Baylor. It was so bumpy, and I remember the paramedics, EMTs driving so fast. And I was probably about 10 minutes in, because they were like, "So, do you think you'll need your neck brace?" And I was like, do I need it? They were like, the doctor said it could be optional for you. And I was like, all right, I'll just see what it's like not going without a neck brace. This is 2 weeks out of surgery. And how long?
3. Because
okay, about 3 weeks. And I remember driving in the ambulance for the first 10 minutes, and it was so bumpy. It was so painful. I had the EMT in the back. I was like, you know what? I think I'm going to put on my neck brace. And man, for probably the first 2 to 3 months of having this injury, that neck collar was probably like my best friend. I slept with it. I showered with it. I did everything because my neck was just so weak and so sore. It was like the thing that was just keeping me upright. And I just remember that, and the drive from Lubbock to Dallas went by quick, and it just felt so weird. It felt like when I came back home, keep in mind, like I haven't been home in probably 3 months prior to my injury. So I've been at school for the majority of the time of the year, maybe even longer. And it just felt weird going from Lubbock back to Dallas, hometown, and not going home or anything. It was just like hospital. You're laying in this like a little hospital stretcher thing that they take you in the ambulance. And then you go straight and they check you into your room at Baylor Scott and White in Dallas. And it just felt so weird. It didn't feel like I was at home at all. And yeah, so from there, I did therapy for 2 months, met a couple of people. That's where I really got my toes in the water of understanding really what this injury was about. And that was a big time when it really hit me, was when they would take us to like these small classes and teach everybody who's had a spinal cord injury about what it is. And I remember sitting there like in my electric wheelchair, not even able to drive my wheelchair because I was just so paralyzed. I remember sitting there and thinking, this cannot be me. 3-4 weeks ago, I'm at a fraternity party, having a great time with all my buddies and going to the gym and working out. And 4 weeks later, I'm in this rehabilitation center learning about a injury that I've never heard of, and them telling me what my level of injury is, and explaining to me like how life is going to be. And it sucked because it felt a little negative. This is where it is. This is where your life is. And this is how you're going to have to adapt to it, instead of at least giving someone a fighting chance of saying, you're going to work hard and you're going to get through this. I'm telling you, sometimes, I wouldn't say lying's good all the time, but sometimes a fabricated lie can really boost someone's morale. And I'm not saying that what someone's telling me is a lie, because I believe that I will walk again. But for someone who doesn't know, because I didn't know at the time, someone told me, you know what, you're going to be fine. You're going to work hard. And there is a big possibility that you could walk again. I would be like, that would have changed my whole perspective about it. But going in a place like that, they just tell you like, this is how it is. And we need to prepare you for how it is and this and that. And it's not really motivating at all. It's just like almost as if you're in hospice or something. Like they just have everything lined up for you, or you're just like, this is it.
That is where we started veering off, like going the path that most people go on when somebody has this injury. Like, and when we were in Lubbock, I remember a nurse coming in there and saying, okay, telling the nurse that was going to relieve her, okay, he's a quadriplegic. And I said, wait, time out. I said, do not say that in here. We don't know. Right now he's injured. We don't know what's going to happen. Don't know him at all. And I don't know why it's so hard for me to even, I just, and still now, I know this is not you. I know this is part of your journey in life. And I don't know if you remember me telling you, son, one day we're going to look back at this and you're going to say, me with my neck was the best thing that could have happened to me. I told him, I was like, son, you are getting lessons in life that people that live to be 90 years old maybe get, that how everything's just so insignificant.
Yeah, I do feel like an old man now too. Especially like when people are driving, and then now I see these high school kids driving, and I'm 23, and I'm like, oh, these kids, they drive so fast. My parents just laugh at me, and they're like, you're so old now.
Well, yeah. Everything is just stuff. But if you have your family and you have your faith, and there's really, you can't do anything without that. So yeah, when he went to that rehab place, it was very generic. And I found this out later. I'm like, why is anybody putting him on the leg? What is the
exoskeleton or any more modern like treadmill features or anything? This is supposed to be the top rehabilitation place, like one of them in the country, and they just had gotten this accreditation and stuff. And I'm not putting down. I know. I'm sure it's helped so many people, and I'm not trying to put that down, because for a lot of people, that's like the only rehabilitation they'll maybe even get for the rest of their lives with this injury. I think both of us being a little bit more on the stubborn side, we're going to do it this way. I'm like, okay, not accepting that what they would come in and say, he's going to do this. It's like, okay, we've got a question. Like, why? Like, why isn't he not doing this? Okay, I know if you're not putting him on this stuff, he's going to not that smart. But I know if you don't use it, you really lose it. And when they finally did put him on that exoskeleton, like he went from the first time, one leg was like 98%, and it measures like how much work you're doing and how much the machine is doing. So it was like 99% and 98%. So barely even doing it. The second time he did it, it was like 50%, 48%. And I'm like, okay, so if we do it again, it might be better. And it turned out that insurance, they don't look at, of course, every case. They look at, okay, this is his injury. This is what's expected. We're not going to pay for that. And I didn't know that until after we left
that facility. And
I think you bring up a really great point, though. And just like modern medicine, many times is just about that. It's like, how much will the insurance pay? And because the insurance is basically, hey, this happened, we're looking at it as a loss, we're going to try to figure out what we need to do to settle it, that kind of thing. And it just, unfortunately, that's what drives a lot of mainstream medicine. And I'm just so, number one, I just got to say, I'm so impressed that, number one, you both kept faith no matter what. Even when, quote, experts told you, hey, this is the way it's going to be, you both said no. And you kept your faith and you kept that faith strong. But then also the fact that you veered away from mainstream medicine and looked for alternatives, was that how you eventually ended up coming to find out like about the PDPA technology and these things? Or
And I think the way that we figured out about all these new treatments was just, we're super lucky to have family friends and friends of friends who knew people. And honestly, you really learn a lot too from like people who are in the same situation. I've actually learned more probably from people in wheelchairs than I have learned from physical therapists. The majority physical therapists, I still learn a lot from them, but I'm just saying you really learn a lot from people who are going through the similar injury and them knowing people and them having resources. And we're just lucky to have family friends who know people who can do these breakthrough treatments and stuff.
and how did you guys come to decide to do that? Like, when did you say, okay, I'm willing to try this new kind of breakthrough treatment?
I've always been a Christian. Ever since this happened, I literally have seen how God works, and He's working all the time. And I'm just so grateful that He has guided us in ways, and we are just, anything good has happened other than God is using us to just say, hey, He can do miracles, and He has done miracles. And just so many things, how things worked out. And when he played football, his coach, he was still in high school, okay? The coach
who recruited me for like when I had a walkthrough at the university, the first university I was at, he recruited me.
Yeah, he had MS, and when I was there with him, this is when he's 18 years old, and he said, yeah, he was like, I had to retire, and he goes, I flew to Panama, and I got these stem cells put in. He goes, and he was very good about recording his progress, and he literally was like, I am better than I was. He was in a wheelchair. He had to retire from being a football coach at his high school, and he was like a state champion. He was a really big, amazing coach.
And I would say those treatments are really good. I think the only difficult part about those treatments is how far it is and how hard it is with FDA clearance. And just when you look deeper into those treatments, some of the, I don't know, maybe like side effects that it could have potentially. But I guess what Mom was trying to say too is like that, just knowing people like that who've just,
how it came back, and just, hey, he did stem cells. And I called him. He told me about Panama. And then my husband, he just reached out to everybody that he knew. And they follows this one guy, Dave Asbury, and he had reached out to him and said, hey, my son had this accident. It's actually his stepson. And he gave him the name of a doctor. We were like really considering going to Panama, trying to work out the logistics of it. It was that one procedure, just to do that one procedure, it was going to cost $27,000. And that's without the traveling. And how are we going to travel? We were still trying to figure out, how do we work day to day? We were required as parents and caregivers to take classes, and they had to report that they taught us certain things. And I was like, we don't have to worry about that because he's going to walk, and we're going to do something and he walks. And just not even being able to put my mind around, okay, we hadn't even thought about getting a vehicle because I was like, oh, maybe we'll need one until we first walk, not thinking how long this journey was going to be. I remember when they they told us about us doing bowel and like,
For simple terms, bowel program is a way for us paralyzed people to take a crap. And also they had to teach mom how to use a catheter too, like an in and out catheter. So when you have this injury, it was later, but they still taught her at the hospital. And when you have an injury like this, you're not able to urinate or fully empty your bladder for some people. And so they have to teach you how to use a catheter. And I remember for mom, it was just like a big shock for her.
it was just like the amount of care that he needed was just so misunderstood. Like he said, I didn't know anybody. Yeah, I knew one person that had a spinal cord injury. So that was really, and doing shower, and the nurses aides would do the shower and bow, and they would ask me to step out and wait. It would take about 2 hours and stuff. And I'm like, what are they doing in there? And I didn't understand exactly what they had to do, what it entailed, and how invasive it is for him. And this is my grown man son. He's hairy, he's a man. And to have to, not even as an infant, to do certain things to him that he needed now, were like, oh my gosh, this is crazy. This is crazy.
I was going to say, fast forward to the end of therapy, which made it even more hectic. Keep in mind, I haven't been home in a while. It's been a while. And it just happened to, it's crazy. It happened. Mom and Clark, my stepdad, and my little brother were in the process of moving home. So the last time I was home was when we lived in Plano. I'm at school. I'm just doing what I do at school. And then I have my injury. I go to therapy. So I still haven't been home. I've been in Dallas. I leave physical therapy. I leave Baylor Scott and White. And it was so weird. It was like I come home for the first time in who knows how long. And we get to this new house, and it's out here in South Lake now. And it was just a big shock for me. I felt like it felt like I hadn't been home in years. That's what it felt like. And they were in the process of moving in, and I didn't have, at the time, when you're at Baylor, they give you information about getting shower supplies and your bed and all the stuff that's needed. And we put in the order, and we were still waiting for an order. By the time I got home, I didn't have anything. Like the first night we got home, we had a bed from the last house that we used just like if we have a friend spend the night or something. So we just put it up in my room, and I slept on that the first night. But I just remember like the huge adjustment of what it was like coming home. Like I was a little nervous actually coming home because I've been around this medical environment since I've had my injury.
And now I'm your nurse.
I know.
Mom and nurse together.
Yeah. And so it just was a huge adjustment, like coming home and not actually being in like a medical environment. And yeah, I don't know. It was a crazy feeling.
Wow, that's so much to go through. And then when did you start to do some of the therapies, the kind of the more like the PDPA therapies? And could you maybe describe like when you decided to do that, take this step toward this kind of newer technology that's maybe not part of mainstream medicine yet?
I think like the first thing that he did was the doctor in Austin, and not knowing anything about stem cells, just what we read and what, from the time he
Those were personal stem cells that I did. So they extracted them out of my body, and then they also extracted the plasma, platelet-rich plasma, PRP. And that was the first treatment I got. And I think that's when we had our toes like dipped in the water of understanding like that there's other treatments besides just this physical therapy of lifting half a pound. all day. And so that's how I figured out about it. And then, like I said, family friends gave us information for David Bell and then meeting you. And that's when we got into it. And we also had a family friend who actually had a really bad car accident. And she had a really bad spinal compression. And she did her therapy at Baylor, Scott and White. And she was in a wheelchair the first part. And she started walking later on, but she gave us info for another place called Adaptive Training Foundation. And it's a nonprofit organization and they are amazing. If anybody ever needs the information, I'm willing to give out the info for that place. They are awesome people. I've had buddies who are the lady friend that my parents and I know, the one who had a spinal compression, she went there and she was like, she told mom, she goes, "Hey, you should tell your son about this place called Adaptive Training Foundation." And we checked it out. I met a trainer there who's been training. He's awesome. His name's Sean Fitzmaurice. And he is awesome. And he, like I said, he's been training people with spinal cord injuries for probably 22, 23 plus years. And I met him there and I learned, I really gained a bunch of strength and I really excelled when I realized that this isn't like just your average medical aspect of physical therapy. This feels like I'm going to a gym. This feels like I'm going to go work out. This feels very positive and motivating. Everyone there is very holistic. And just being there and being around people who have similar injuries, and it's like first responders and people who are in the military and like all these people who are awesome. Just being around everybody and the camaraderie of just being with those people helped me like push forward. And it made me realize, hey, having this injury isn't all about just like this clinical physical therapy. It makes you realize like there is more out there, but you got to put yourself forward and figure out where it's at. And that was a big way I got into it. And then once I got out of doing that, doing the physical therapy there, I know my stepdad, Clark, he contacted, I think, David, and that's how he got in touch with all y'all.
One of his roommate is friends with David. This is what I'm saying, how God works. How I met Lindsay Johnson, the one that introduced us to ATF.
The one who had the spinal compression.
Yeah. My sister-in-law was getting her hair done and she's telling her what happened to her nephew. And she goes, "Oh my gosh, one of my clients, she had a spinal cord injury and and she's walking. Let me give you her number." Just things like that. Okay, what are the chances? And then I called her, and it's so incredible that this community, nobody wants to be a part of. How it's so easy to just close everybody off and be depressed about this. But you've got to force yourself because there's somebody right now, this is happening to somebody, and somebody is terrified, and somebody, just like we were, needed some hope, needed to not have hope. When somebody says, "Accept this is the way it is," that is okay. So why do I even try to have your hope taken away when a doctor, especially a doctor, tells you this is what it is? Don't get, this is, just accept this. It's devastating. It's devastating to have your hope taken away. And when you find somebody, hey, this person, that person did this, and I contacted Lindsay, and she was just incredible, and she found some guy, and I don't know, like back alley stuff, that injected stem cells in her toes. That she said was the first time that she moved, she said it hurt so bad. The first time that he moved, she was able to move her toes. And so so we're all looking for this puzzle piece of this. It's like a lock where it's not just this one therapy is going to help. It's a lot of pieces to this puzzle that we're just looking for this combination, this magical combination, but it's there. It can be unlocked. And there's a lot of moving parts to it. And it starts first with this kid's mind. And I could search everything in the world. Hey, it could cost $1 million if we could afford it, whatever. But he had to decide that he was not going to accept him being like this. And he's not paint a picture of, oh yeah, it's roses and we're so positive. It has been a struggle. It is literally, it is taken out. We're physically and emotionally exhausted from this, but we got to keep on going. We got to keep on going. We don't have a choice. We don't even allow our brains, our minds to go thought of what would you do if suddenly you could not move anything. She had the thought, and it's not just a thought, it's a reality, and it's reality to us. A lot of times it's very easy to just, oh my gosh, this is so exhausting. And we found so much hope with this situation. And it had to build up to this. I think this is all, when I go back to being a Christian, I think if he were just to get up and walk, all this whole lesson would be lost. And he at 23 years old, let me tell you, I was a total mess at 23. I don't know how he's able to still laugh about stuff. Mind you, sometimes I'm like, hey, that's his little dark humor, but
I read that David Goggins book.
oh, sure.
Mine's that.
Oh, yeah. Now,
someone's got to carry the boats and the logs, baby.
I've got to say, you definitely have made a huge transition. And just like we were talking about before, I think you have a big message to share. For the people that are maybe who've had an injury like this, people that are watching this, or maybe it's a doctor who's watching this, who has a patient who just had an accident like this. Could you maybe talk about more about how you went from, how you've seen this transition from you clinically? Because we see, when I'll share the image real quick, if that's okay. Here's the image again of your spine after the injury, where we see basically a large projection of the fracture essentially compressing and cutting the spinal cord. We even have a gap that appears here on the image. And then here it is after the treatment with, it sounds like multiple treatments and also physical therapy, but also with the placentally derived protein array or PDPA technology, where we now have this kind of connected here. What did you see clinically? What did you see like functionality wise, I guess I should say?
Yeah. To backtrack a little bit, when I first had my injury, I couldn't move anything. Mom literally had to scratch my face whenever I first had my injury in the hospital. I would have an itch. I'd have people have to shave my face and brush my teeth. And I couldn't do anything. And fast forward months later of finding out about y'all and these treatments, it is an instant. I think people have to realize a lot of things in life really aren't instant. I think in today's society, everybody wants everything now. And I think that's just how we are as humans. We always want everything instant. But when I first started doing these treatments, I think the first thing I noticed was a slight change in body temperature. Like when you have an injury like this, you tend to either be like super, super hot or super, super cold. Like you just have these crazy temperature fluctuations. And I remember when I first did my first stem cell treatment, I noticed my hot and cold sensations weren't as bad as they were before. And just over time, doing these treatments, these new treatments actually with y'all, I'm 4 treatments out of 12 in, and so far, I gained so much more sensation. I'm able to move my arms. I'm able to sit up on my own. I've gained feeling on my back, on my bottom, on my arms, my fingers, my legs. Recently, my toes now and the bottom of my feet.
So he did similar treatments with David before. And then David, and I just want to say, David Bell did not give up on this situation. He really has dedicated so much time into figuring out how the first time we went to go do a stem cells, this procedure with the neurologist.
Dr. Droisman at Southwest Pain Management in Las Colinas.
So when the first time and this is before meeting you and when you guys got involved, David, he's 6'4", big guy. And that's the first time I met him. And he was going to introduce us to the doctor and all that. And he said, your kid's going to walk again. And I'm like, look at me, David, don't tell me that unless you really mean it. And when you're in this position, you will literally, if somebody says, pay me this, I will have your son walk again. You're so vulnerable. It is so easy for people. There's all these places, these pop-up places where come do this and that, and it's thousands and thousands of dollars. But in our position, I told Nando, we'll live at the bridge if we have to get you a walk.
I said no, but Mom didn't. She didn't really agree with me.
The first time I met David and how he just looked me right in the face, unlike anybody else had, and said, your kid is going to walk again. He goes, no, your kid's going to walk again. We're going to figure this out. Your kid's going to walk again. The neurologist and he's fabulous, a perfectionist, and he's the one who puts this humongous needle in his. It would be so easy to injure him even more doing this procedure, but he's amazing and he does an incredible job. David puts this whole program together and he says, listen, we think we figured something out. And he gave me the whole protocol and it's very intense. And there's, like I said, a lot of moving parts. And he said, we really believe that your son could be walking within 12 to 18 months. And it's, oh my gosh. Okay, now now there's a time here now too, which is like, okay, this is not, it's some time in the future, whatever. That's like saying, okay, you broke your arm, but it takes about 6 weeks. Going into this, I think for me, very excited. Like I said, hope, it's so hard not to have hope. Hope can be a very scary thing too, because if you have hope without kind of being a little bit realistic about, okay, it could be very devastating to not have whatever you want so badly, to work out. Different things that we were doing with this procedure. Before I spoke to you, it was Super Bowl night and putting him to bed, right? Had just put some compressions on his leg. We were about to do our third treatment, actually. Put my hand on his leg. He goes, Mom. He was like, Mom, okay, wait. And he closed his eyes. Mom, okay, don't touch. And he's like, oh my gosh, Mom, I feel that. And he's like, Mom, I totally feel that. It is like those little nuggets of, wow, this is something.
Like physically seeing it and feeling it. It was an incredible feeling.
It was so exciting for him. And this is the first time he went from going here to here with his workout. The look on his face of, oh my gosh, it is so priceless when he feels like he's accomplished a lot.
Yeah, I think I'm just hard-headed on myself. I always strive for the best. And I don't really like settling just for average. So sometimes it tends to end up carrying over and making me negative about myself, but I use it as motivation. When I see something like that where I'm like, oh my God, for someone who has like a cervical injury to have feeling on your feet and on your legs, it's not exact feeling, but it's feeling. There's a connection. It was just so shocking. I couldn't believe that someone with a level an injury like mine could actually gain feeling like that. And especially 2 to 2.5 years out. Crazy part is you're still recovering so much function and feeling, and you're still so far out. Whenever I was in the hospital, I was told after a year, what you had is what you have. Another awesome thing, probably 4 or 5 weeks ago, I was able to stand. So I had my hands strapped in and I had someone help me prop my hips up. And I was able to stand for 15 seconds without anybody helping me with my hips or anything. Just standing there using my hips and balancing. And I was like,
Wow.
oh my gosh, I'm standing. Okay, so move forward, another 4 or 5, another 4 weeks later, I go and I stand and I'm thinking, I was telling Fitz, my trainer, I go, Fitz, are you helping me? Are you touching me? He's like, no. I was able to stand for 12 minutes straight
Wow.
without any help. The same exact standing that I did for 15 seconds. Move forward a couple more weeks later, and I'm standing for 12 minutes. That is huge. Huge.
That's incredible.
It's sticking too. Like a lot of these treatments and a lot of these workouts that I'm doing are sticking too. So it's not like I'm just getting it one time and then I forget. It's actually, I'm remembering, my body's remembering how to do it. And I'm remembering where I am in space in terms of standing. I would say having this injury and doing any type of balancing feels like, I would say picture like a pencil or pen, and you try to balance the tip of the pencil on a flat surface. The pencil will fall in any direction. And that's exactly what it feels like trying to sit up or stand. And that's the best way I could compare it. It's like walking on a tightrope, but you're not falling left and right. You're falling forwards and backwards and left and right in every direction. Yeah.
And I think what, in case the viewers don't realize and the listeners don't realize, like your injury, if you in medical school, if they were to show this image, they would tell you, hey, this is done. There's no more that you can do. This is it. And just the ability to stand is incredible. And the fact that you're consistently gaining now and you're headed in an upward momentum is just absolutely amazing.
It is.
If there was someone who was out there who suffered an injury like yours and they were in a situation, maybe they didn't have the same connections, maybe they didn't have such a good support network, and they're out there, they're wondering like, what can I do? Would you recommend regenerative medicine? Would you recommend, what would you tell them?
I would 100% recommend this medicine and this modern procedures. It's incredible. It puts it in terms of like mom talking about selling everything and living under a bridge. I know it sounds very extreme, but it's like you have one life. As a human being, we all just want to live the best that we can possibly live. And if you think about it, sure, I won't sugarcoat it. These procedures are pricey. Is there really a price to put on living your life? Is there really a price to put on living free as a physical human being? This isn't like me buying a fancy car or buying a fancy watch or buying a fancy house. This is like real life stuff in terms of you being a physically free human being. And not only that, just by doing procedures like this extends your life. Just by having an injury like this, your lifespan shortens. And I would 100% recommend this to anybody. I know it's pricey, but it's really hard to put a price on something so precious, such as being physically free as a human. It's a lot deeper.
This is not just the hopes and, oh, we're just going to hope that this works. There is physical proof of something changing in his spinal cord. You said his spinal cord is thickening, is actual proof that this is working.
It's a good thing too when you see a doctor get excited.
Yeah.
Because usually it's more just like, you'll be all right, buddy. It's never like, this is actually working. It's a good sign. The place where I was getting my procedures, they were actually starting to play joyful music there. It was like something changed. It was like a kid on Christmas when I saw him look at the phone. You just couldn't believe it. He just was like, in my 20 plus years of my practice, I have never, ever seen something like this.
He said, this has never happened. He goes, this has never happened. I've never seen this. In all my years of practicing, I've never seen this. He goes, this needs to be documented. He goes, this is incredible. He goes, he said, this is history. This is changing history. And he looked right at my mom and I and said, you guys have witnessed a miracle. You guys have witnessed a miracle. And for all the people in the world, I'm like, but you know what? Somebody had to put their kite up there and get struck by lightning. Like, why can't it be him? Like, but when a doctor looks at you and says, this is a miracle, this has never happened, and you want to ask if this is worth the money, do a GoFundMe, do whatever you can to try this, because you don't have, there's options, and then there's a way that you can get better. The Lord is my witness. I would never steer anybody wrong as a parent. I would never say, spend your money on something and me knowing that I'm exaggerating the results, or that this is concrete evidence. It's so huge. It's so mind blowing that it's even hard to put it in perspective. And we tell people about it. It's every time we tell somebody about it gives me chills. 100%. 100%. This is not just an option. Oh, this is like the last option. This is the option.
All you got to do is just take it one day at a time. So that's what I told myself. It kind of helps you from going crazy. Go to therapy and just work hard. And I do plan on going back to school too, which is really exciting. And like I said, I'm just taking it one day at a time. It's really all you can do. I try not to stress about tomorrow.
I love you guys. You guys are great. And I just want to say that you're both part of the miracle, and both your mindset and Kristina, I don't think that maybe you realized it in Fernando. I think this may be the way you were, but you guys have such a powerful mindset because it is so easy. And our mainstream medicine system makes it this easy to basically give up and to accept the way the things are, and to not believe that there's anything that can be done. But you didn't stop. You kept the faith the entire time. You sought answers. You went from one thing to the next until you found a solution. And then now you're able to, like you saw with that doctor, you're literally rewriting medical history. You're changing the entire world for yourself and for everyone else who follows you.
Yeah. I just want this to help everybody. It's a terrible injury. It doesn't matter how rich or how poor you are. When you are when your physical freedoms are stripped away from your life, it's a terrible feeling. Yeah, sure. Having money, yes, it can help you excel in some aspects, but you can have a terrible injury and be the richest person in the world, and still doesn't always mean that you're going to fully recover from something like this. And what's exciting is that now that there's more medicine coming out, like what y'all are doing, it is proven that there is a possibility. I want people to see that the walking and everything, it doesn't just come for free. It doesn't just come easily. It's a lot of hard work, but I'm willing to put in any of that work just to be physically able-bodied again.
And it's like a duty I feel like it's our duty now to let people know, okay, because so many people helped us. It is our duty as Christians and as human beings to say, hey, listen, if this happens, don't give it.
I love both of you guys have such a great attitude, and just keeping that faith, I think, is really critical, because without that, you would have never been able to even see a potential solution. And I feel very fortunate to be part of your life as well, and to be able to witness this and also help with it. And just for any of the medical people that are listening, one of the things that we're doing is we're recording your 3 Tesla, which is one of the highest quality MRIs you can get, with special quantitative data that we can basically show that your spinal cord volume is actually increasing. And so we're monitoring that as a way another independent metric to show that, okay, we can see that this is getting better. You have, of course, the fact that you can stand, which is in many, like most people would tell you, that was impossible. That's a miracle. And you're able to do that already. So much to be grateful here for. But also, I just wanted to congratulate you guys as well, because it's only through just the fact that you've gone through this journey, the amount of growth and the amount of ability that you had to push yourself to deal with this situation is just absolutely stunning. And it shows what kind of character you guys are. You have amazing character.
Your life is not over if this happens, basically. If you have an injury, like, it is not over. There's so much to be grateful for.
It took me a while to get used to it, and getting used to going out and being surrounded by other people. And then I just got to a point where I was just so tired of it. And I was like, you know what? Screw this. Life's too short. I'm just going to go out with my buddies and just have fun. And then you go out and you realize people don't really care. You talk to people and they're super supportive and they're pretty cool. And it's nice. You get to cut the lines at the bars sometimes. Wheel you to the front. Yeah, but it's eventually you'll start realizing that you can start doing little things in life and slowly becomes a little easier.
Man, what an incredible story. And thank you guys so much for sharing.